Hello guys, this is Dr. Richa. Welcome back to my channel. Hope you liked the previous lecture. Okay, today we are going to discuss a very important and interesting topic of biochemistry, that is heme synthesis and porphyrias. So without wasting time, let's get started. As you all know, heme is a major component of hemoglobin that is crucial to carry oxygen in the blood. So, first of all, we'll discuss a bit about the structure of heme. So, here comes the structure of heme. Heme consists of tetrapyrrole ring along with iron. There are four monopyrrole rings, as you can see here, 1, 2, 3, and 4, and in between a heme is attached. Okay, you don't need to remember the structure, just have a look upon it. Okay, coming on to the synthesis part, heme H resembles 8, so there are 8 steps of hemoglobin synthesis. Here comes the points to remember. These are some points to remember before starting the main synthesis pathway. For there are total 8 steps, among them first step and last 3 steps occurring in mitochondria and rest occurring in cytoplasm. As we have discussed earlier, monopyrrole, 4 monopyrroles are consisting in the heme, which forms tetrapyrrole. First of all, which is linear, and then it will become the ring form. So tetrapyrrole linear form is known as hydroxymethylbilane, HMB, then porphyrinogens, UCP, we'll discuss that later, and ultimately protoporphyrin will be formed, in which iron will be added and the final heme will be formed. Okay, now, okay. The third point to remember here is porphyrinogen 3. Porphyrinogen 3 is the most important precursor for the heme synthesis. All the porphyrinogens usually comes in the 1 and 3 form. The 3 forms are the most important ones. The 1 will not get a desired heme. It will lead to either a defected or not no heme at all. So remember, porphyrinogens 3 are the most important ones. Then coming on to the ring formation steps. These are the steps. Ring formation steps you need to remember by this mnemonic. You can pass with flying colors, where U stands for uroporphyrinogen, C stands for coproporphyrinogen, PAS stands for protoporphyrinogen, and flying colors FC stands for ferrochelatase. Okay, ferrochelatase that adds iron and ultimately leads to the formation of heme. Okay, guys, coming on to the main pathway. The main pathway is, first of all, the key here to remember is ELA. ELA is amino levulinic acid, delta ELA. First step will be the formation of ELA. So the enzyme here is known as ELA synthase. And the second step will be the dehydration of ELA, that is removal of water. So remember, ELA, first step will be its synthesis and second step will be its dehydration. So to remember the first step, you just remember the mnemonic SAG, very easy mnemonics you use in your daily practice for calculating the ascitic fluid gradient. Okay, serum albumin and ascitic fluid gradient. So SA here stands for succinyl-CoA, another A is for ELA, and G is for glycine. So succinyl-CoA and glycine combines to form ELA. The enzyme involved is ELA synthase. The extra point you need to remember here is that it is the rate limiting enzyme. This is very important, that it is the rate limiting enzyme for the heme synthesis. And the second point is to remember that the coenzyme here is vitamin B6 or pyridoxal phosphate. Okay, guys, coming on to the next step, ELA dehydratase will act upon ELA and there will be removal of water and formation of the monopyrrole, that is porphobilinogen. Okay, the point here to remember is that ELA dehydratase is inhibited by lead. So in lead poisoning, ELA dehydratase will be affected and there will be no heme synthesis or less production of heme. Then the third step will be deamination, that is ammonia removal. From porphobilinogen PBG, there will be removal of ammonia. So, as the name suggests, there will be enzyme known as PBG deaminase, or the first linear tetrapyrrole will be formed from the four monopyroles. So, as we have discussed, that linear tetrapyrrole is also known as hydroxymethylbilane. So, it will be formed, and the enzyme can also be called as HMB synthase, and ammonia is removed, so it is known as PBG deaminase. You can take a look toward that the third name of this enzyme commonly asked is UPG1 synthase. UPG1, why it is UPG1, I'll tell you later. From the hydroxymethylbilane, the step 4, that is synthesis of UPG3. As we have discussed earlier, that all the porphyrinogens or porphobilinogens, there will be UPG3. Okay, so UPG1 will form a defective heme or no heme at all. If there is no enzyme available after hydroxymethylbilane, the spontaneous reaction will go towards UPG1 or CPG1, and ultimately it will stop and there will be no production of heme. Then in UPG3 synthase will act upon HMB and there will be a formation of UPG3. Then the next step will be decarboxylation and the other two steps will be oxidation, and ultimately there will be chelation. So you can remember, like, decarboxylase contains C, so one C will be removed and next C will come on the action. Like UPG decarboxylase will come, CO2 will be removed, and next step is coproporphyrinogen 3 will be formed. Then uh, two oxidation will be occurring here. First one is CpG oxidase and then PPG oxidase will be there, ultimately leading to the formation of protoporphyrin. And last enzyme here to work is ferrochelatase that adds iron to protoporphyrin, and there will be formation of heme. So guys, we here remembered the mnemonic you can pass with flying colors. You can write it over there so that it will be easier for you to remember all the steps. Okay, moving towards the crux of this lecture, that is porphyrias. Trust me guys, by reading this one sentence, you can solve all the MCQs on porphyrias. So here comes the sentence or the mnemonic. We have a plumber here, supposingly his or her name is X, let's say, who intermittently comes to your place and cut hose pipe with variety of equipments. Just remember this sentence. First of all, X here stands for X-linked porphyria. Then plumber is also known as plumbo or DOS porphyria. Intermittently is for acute intermittent porphyria. Then comes, you can remember CO for congenital erythropoietic porphyria. And cut, you can remember for cutaneous tarda, porphyria cutaneous tarda. Then hosepipe, remember for hereditary coproporphyria. And variety for variegate porphyria. And equipments for erythropoietic porphyria. Okay. This eight, the 8 words of this sentence signifies the enzymes defective in the 8 steps of the heme synthesis cycles respectively. So from the X, the point here to remember is the acute intermittent porphyria is the most common acute porphyria. Cutaneous tarda is most common overall, and erythropoietic protoporphyria will be seen most commonly in children. So I have written the enzymes. You can remember these enzymes from the cycle above. Just remember here, the more later half of the cycle enzymes defected, the more will be the photosensitivity due to porphyrin's accumulation. So after the fourth step or from the congenital erythropoietic porphyria, there will be more photosensitivity, and up to the acute intermittent porphyria, there will be more of neurovisceral symptoms. Okay guys, just remember some points here and we are done with porphyrias. Okay. First of all porphyrias are autosomal dominant except, as we have learned, X-linked protoporphyria, that is due to enzyme defective ELA synthase. And the second one, remember the word COP stands for CO is for congenital erythropoietic, P is for plumboporphyria or DOS porphyria, and E is for erythropoietic protoporphyria. These three will be autosomal recessive, and Ella synthase defective will be X-linked protoporphyria. All other will be autosomal dominant. And you can also remember that autosomal recessive will present earlier in life than autosomal dominant ones. Okay, coming on to the next point, that is Ella synthase mutation. Both of the mutations will be X-linked only. First mutation is gain of function mutation and second one is loss of function mutation. So gain of function mutation is known as X-linked protoporphyria and loss of function mutation is known as X-linked sideroblastic anemia. You can remember it like this: loss of heme, there will be anemia, will cause anemia. So loss of function mutation of Ella synthase will lead to anemia, which is sideroblastic in nature. The question here is, which vitamin deficiency causes sideroblastic anemia? Guys, we have discussed in the pathway that the first enzyme, that is Ella synthase, requires pyridoxal phosphate. So here the Ella synthase will be defective. So it will, or either Ella synthase or pyridoxal deficiency, both can cause sideroblastic anemia. Now coming on to the third point, that is acute intermittent porphyria. It is the most common acute porphyria. The most common symptom here, the patient comes with pain abdomen, which is often misdiagnosed as surgical abdomen. And from acute intermittent porphyria, you can remember the most common sign is tachycardia. Just remember it like this: patient is in pain, so pain can cause tachycardia, and due to pain his urine also become pink. Okay, coming on to the next, congenital erythropoietic porphyria. Just 2 points you need to remember here, that it is also known as Gunther's disease and it can cause non-immune hydrops. Guys, try to remember both of these points because these are already asked as an MCQ in your previous years. Now next is Porphyria cutanea tarda. We have already discussed that it is the most common porphyria overall. It can cause blistering photosensitivity. The word blistering is very important here because the congenital erythropoietic porphyria and the erythropoietic porphyria, the next one, will not cause any blister. Blisters are formed in Porphyria cutanea tarda. You can remember this by remembering cutaneous word, cutanea word in the PCT, that is cutaneous involvement will be more, so there will be more blisters, and it is also associated with hemochromatosis. Okay guys, last but not the least is the SORID band. For the lab diagnosis of porphyria, we have the SORID band, that is absorption band occurs at 400 nanometer. So this is all for the today. Thank you so much guys for your support. Kindly like, share and subscribe my channel and give your valuable feedback in the comment section below. All the best guys.